Hey, good morning. My name's Colonel Kelsey Smith, and I'm your Garrison Commander here at Redstone Arsenal. And this is Colonel Anthony Meador. He is the Commander at Fox Army Medical Center. We're here this morning to talk to you a little bit about Redstone Arsenal's response and preparations for what you all have been tracking on the news media as a COVID-19 virus outbreak here in the United States. My job today here is to reassure you what Redstone Arsenal and our health providers here at Redstone Arsenal are doing in order to provide a safe and secure environment for you to come to work and for our mission and tenant partners to conduct their mission in a safe and secure environment. As you know, and as I've talked to you many times before, our role is to provide that safe and secure environment, and our mission commander's job specifically is to continue to execute their mission. The way we are going to be able to work our way and lead our way through this is to ensure that Redstone Arsenal, as the garrison, we continue to monitor the environment around us. Likewise, Redstone Arsenal and our partners are monitoring the COVID-19 situation across the Tennessee Valley and the 16 counties that encompasses. And then we are monitoring any potential cases on the arsenal so that we best understand the situation that we find ourselves in. Likewise, we'll use that information in order to make informed and prudent decisions to adjust or implement controls on the arsenal in order to ensure that we continue to provide a safe and secure environment. Today, Redstone Arsenal has begun a crisis action team event where we conduct planning 3 times a week. That planning is specifically oriented to how to track, how to contain, and how to prevent any potential viruses on the arsenal, and then likewise to come up with the controls that we need to implement in order to continue to provide a safe and secure environment. In addition, Redstone Arsenal outside of the garrison is meeting with all of our tenant partners once weekly currently in order to level the bubbles or synchronize what services are impacted and what missions are impacted, and to synchronize the messages so that we can continue to educate the workforce and educate the mission partners so that we can all continue to work forward towards a common goal with a common message. And then finally, our PAO and our PAO mission partners are meeting twice weekly to ensure that the educational messages that we need to get out to the workforce are provided, and they're synchronizing those messages with all of our surrounding communities in order to ensure that the messages being given by Huntsville or by the CDC or by the Department of the Army or the Department of Defense are all consistent, and that as you read those announcements in your workplace, you can be assured that all of us who are charged with protecting you, all of us who are charged with providing you a safe and secure environment are doing so as a united front. And what I've asked Colonel Meador to come here and speak with us about the prevention measures and the educational platforms that they would like to get out to help better protect our workforce. Sir?
Yeah, thank you. As Colonel Smith mentioned, my name again is Colonel Meador, and I'm commander for Fox Army Health Center. And also, in relation to COVID-19, which is a novel coronavirus, we at Fox today, I'm happy to report, stand ready to analyze, treat, and test for anyone suspected of having this virus. A lot of information is out there today, and I'm happy to report that the Centers for Disease Control remains the Department of Defense's lead information agent. So I completely encourage you to look at what the Centers for Disease Control are currently putting out, because that's exactly what we at Fox Army Health Center are utilizing to base how we treat this current virus should it happen to arrive here in Alabama. As of today, there are 0 cases in the state of Alabama, but again, we've taken all the precautions at Fox Army Health Center to be able to, again, treat someone should they have or suspected flu-like symptoms where they feel that maybe this is aspects of COVID-19. There's a lot of information too about what to do for it. So let's talk about some of the symptoms first, and maybe some of the precautions we all can take as we continue to learn more about COVID-19. It is a flu strain, and with that, a lot of similar symptoms are out there. But specific to COVID-19, it's a dry cough, it's a fever, and a runny nose. The more severe conditions that happen from COVID-19 are pneumonia in both lungs, but that's in the rare cases. We have seen literature and read literature for COVID-19 cases that are more severe happen to individuals in some aspects who have underlying conditions. But again, remember, COVID-19 is a flu strain, and those in generally good health are going to push through it. And in the meantime, again, at Fox, we're able to treat you should you be suspected of that, and also important with that is our ability to monitor that. Some preventive measures. They're pretty basic, as you've seen in recent years when we go through the flu season. Don't sneeze into your hand. You want to sneeze into your elbow to try and prevent the spread of those germs. We ask that you use hand sanitizer often. You want to use the hand sanitizer with at least 60% alcohol. Some hand sanitizers go all the way up to 95% alcohol, but 60% is the minimum that we recommend. It's also good, as best you can, to try to not touch your face. I know that's difficult to do. We all do it. It's sometimes an involuntary habit, but as best you can, try not to touch your face. One underlying preventive measure too is if you don't feel well, maybe it's just a general flu or general cold, contact your provider. You want to let them know, as you would for any other condition where you're not feeling well, is to contact your provider, go in, and he or she will be the one to determine where we take your treatment given certain conditions. Now, as you know, there are 4 countries in the world right now that are a level 3 advisory, which means they have a high rate of having COVID-19 currently in their countries. Those are Iran, Italy, South Korea, and mainland China. For us at Fox Army Health Center, we have 2 questions or 2 criteria that we're going to talk to you about when it comes to home monitoring. And those 2 criteria are, if you've traveled to any one of those countries recently, we're going to ask you to go on home monitoring, and you're going to ask, what is home monitoring? That is basically where at home, as best you can, you want to isolate yourself away from your family. It's very difficult, assuming you have a family there, but in your home, what we're trying to do is to keep you secluded for a 14-day period. 14 days is the incubation period for COVID-19. And essentially after 14 days, if you haven't had any flu-like symptoms, then you're more than welcome to come out of that monitoring, that home monitoring. If during that 14 days you experience flu-like symptoms, we ask that you call us. We're going to ask you some questions. We're going to bring you in, as I mentioned earlier. We're not going to deny treatment. We're going to bring you in and treat you and then test. We have the ability to take samples and send those away for testing. It's about a 48-hour turnaround, but in the meantime, we're going to treat you with some various medications to help with the symptoms. And then again, after the 14 days, if you haven't experienced any symptoms, then of course you're free to come out of that monitoring. During that 14-day, I would ask that you help us as we monitor you. You will be in communication with our population health nurse. Her name is Major Williams, where she contacts you. She's asking you how you're feeling. She's taking down your recorded temperature while we're monitoring you during that period. It's a few basic questions, but as best you can during that period, you want to limit your contact with others. But remember that if you traveled recently from any of those countries and arrived back here into the States. And while there are many scenarios that exist, do keep in mind with any flu-like symptoms, we do ask you to be as precise and clear as you can when you're speaking with us so we can better assess maybe which flu you might have. Over the phone it's going to be difficult, but it helps us with when you talk to us about your symptoms that we can sort of detail and analyze how best to treat you.
So today, I guess the final thing we'd like to leave you with is that Redstone operation today is at what's considered health protection condition out or zero, which means that Redstone Arsenal is conducting normal business operations, that the missions here on Redstone Arsenal are continuing normally, and that the protections that are already in place at the medical facility and at your place of business are already in place. We do know that, and as you know, the situation may change, and as that situation changes, we will come back to you in a format like this or through your chain of command in order to explain the next next HP condition and what controls or conditions may go into place in order to ensure we provide you a safe and secure environment to come to work in. Thank you and have a great day.
Thank you.
So Colonel Meador, if I could ask just a couple clarifying questions.
Sure.
So Redstone Arsenal being a federal center of excellence, we have around 80 different tenant organizations. And because of the way we're made up, we have active duty soldiers and their dependents. We have retirees and their dependents. We have DoD employees. And then we have DOJ, FBI, and contractors. Could you talk to us a little bit today about the difference of the difference that has or that makes in who they should first seek healthcare and healthcare advice from?
Sure, that's a great question. And you're absolutely right. We have a lot of organizations here on Redstone Arsenal. For Fox Army Health Center, in the following categories, we would ask that you contact us so that we can provide you the best information possible, along with the best recommendation, given certain scenarios that you present to us. And those categories are anyone currently enrolled to Fox Army Health Center, any active duty service member, any active duty family member, and any Department of Defense civilian employee. And I understand that that left out a couple of categories of employees here on the Arsenal. And for those categories I didn't mention, we'd ask that you reach out to your primary care provider in their recommendation for you on what to do given the symptoms that you might be experiencing or given recent travels that you might have conducted.
So discussing that, we talked about home monitoring a few minutes ago, or what the Army terms as quarantine. And could you talk to us a little bit about how home monitoring would work and the importance for each individual to advise their supervisory chain?
Absolutely. With home monitoring, remember it's just a term to reflect a condition for you to just as best you can keep yourself away from others, because we don't know if, given your travels or coming in contact with someone who has tested positive for COVID-19, if you have it. A few minutes ago I mentioned that the incubation period for COVID-19 is 14 days. And that's a significant amount of time in your home as you're trying to, as best you can, stay away from family members, even pets, as pets can transmit germs that we found given recent literature. And again, with your family, or if you have any friends that you might be living with, we just ask that you keep yourself away from them, again, during that 14 days.
So what I understand of home monitoring right now is if you believe you have traveled to one of those category locations where the virus is prevalent, then you should advise your chain of command or your supervisor, and they in turn will direct you or advise you to go to home monitor, and at which point you should contact your primary health care provider.
That's correct.
Okay, that's important, and we see it as a preventive measure. And most importantly, the advising your supervisor for here at Redstone, advising your supervisor ensures that your supervisor and your healthcare provider will contact Fox Army Health Center. In turn, Fox Army Health Center will contact Redstone Arsenal. Our intent is not necessarily for us to specifically monitor you, but for us to monitor the situation across the Arsenal so that we can assess and advise of prudent steps where, as the virus grows here in North Alabama, where we can take steps to continue to protect the remainder of the population. All right. Thank you.